So now it's my pleasure to give you the President's annual address. Over the weekend, we celebrated 10th anniversary of the NAM, and last night's celebration was wonderful to hear from close friends and colleagues who have been deeply involved with the NAM, IOM over the years. Now, we share memories that span more than a decade of hard work together on some of the most pressing issues, health and medicine. And this is also very personal for me too, as I deliver my final annual meeting address as your president. I'd like to reflect a bit more on our shared past and then look to the future of NAM as well. Let me begin by thanking all of you, our staff, our members, collaborators, volunteers, and partners. You are the foundation of this institution, and whatever we achieve together. As Dr. Martin Luther King reminded us, we may have all come on different ships, but we're now in the same boat now. You know, that is NAM at its best. Diverse people and ideas united to improve health for all. None of this would be possible without you. During this first 10 years of NAM, we have certainly weathered unprecedented challenges to a nation and the world. When I make up a slide, I say, whoa, that's what happened the last 10 years. COVID-19, opioid crisis, clinician burnout, the murder of George Floyd, the racial inequity, firearm violence, impact of Dobbs Supreme Court decision, and of course, climate change, and more. And today we gather in a moment of uncertainty for health and medicine, especially in the US, where science and evidence are under pressure. Federal research funding is being challenged, and scientific structures are being disrupted. Vaccine policy, public health data, and even the roles of career government scientists are being upended. And the ripple effects are being felt every day by clinicians, researchers, and the communities. This is why our working together is more important than ever. I know many of you are very worried and frustrated. I also know that we who have committed our lives to science and public health must persevere, and persevere we will. It is a time for us to lead, be bold, and safeguard our scientific enterprise. The NAM, you, ready to meet this moment. And certainly I will touch upon how we're going to plan to do this. But first, I do want to honor the decades of work that provided the foundation for who we are today and why we are prepared whatever comes our way. Since our founding in 1970, the IOM has been a trusted voice in health policy and practice. We have been fortunate to have exceptional members, extraordinary leadership, beginning with our first president, John Harkness, and continues through the years. Now, it would be impossible for me to fully honor all our past presidents and their many, many accomplishments. So let me take a moment to reflect on the impact of three leaders who immediately preceded me. Each one of them left a mark in health and medicine, and their legacy helped shape the path leading to my own tenure. Let me start with Sam Thier. Under Sam's leadership, we learned how to amplify our voice and make real impact. For example, the IOM published Confronting AIDS in 1986, a bold call for a science-based, destigmatized public health response at a time when many officials were reluctant to act. That report reframed HIV as a national crisis and ultimately helped lay the groundwork for President's Emerging Plan for AIDS Relief, or PEPFAR, in 2003, which today has saved estimated 26 million lives. Then Ken Shine took the helm and began to take a hard look at how to reform and improve our own systems of health and healthcare. In 1999, IOM released Report As Human. By the way, We were not asked by anyone, Congress, others, to do this report. It was the Council and Ken Shine that initiated this really landmark report, which catalyzed the modern patient safety movement, US and across the entire globe, and informed the establishment of AHRQ, or Agency for Healthcare Research and Quality. That report was followed by Crossing the Quality Chasm, which introduced a transformative framework for patient care, quality, and safety. By 2014, reduction in medical errors, driven in part by this work, have saved more than 500,000 lives, prevented 1.3 million infections, and reduced healthcare expenditure by $1.2 billion. Imagine the number of lives we have saved since then. And then when Harvey Feinberg took place, we started focusing on impact in a new way. Harvey introduced the legendary degrees of impact thermometer shown here, a tool for assessing whether our work had led to real outcomes. In 2011, Harvey launched what we now know as NAM Perspectives, a publication that continues to shape national conversations on biomedical research, health, and healthcare. But Harvey oversaw the publication of Accelerating Progress in Obesity Prevention, Solving the Weight of the Nation. This report led to a landmark HBO documentary series co-produced with the IOM, CDC, and NIH, bringing the issues to households across the country. So together, these milestones cemented IOM's role as both a trusted source of guidance and catalyst of long-term change. And they paved the way for our evolution into today, the NAM, a defining moment for our organization. Certainly, one of my most significant responsibilities as I took office. Previously, IOM had functioned as a semi-autonomous institute within the NAS, with the president chosen by NAS and studies overseen through the NRC. So I was charged with creating a new entity with more independence. Transforming the IOM to NAM was a momentous achievement for all of us as an academy, gave us the opportunity to become even more innovative and proactive. Our traditional work was centered on advising, but we knew we had to do more. We have to expand on the robust foundation that IOM provided. As my friend Keith Yamamoto told me, don't let those reports sit on the shelf. So we embraced a broader mission, advice plus action. When I became president more than a decade ago, I committed to servant leadership, to listen, to learn, and to help others succeed. My role is never to lead alone, but to support those around me so that together we could meet whatever challenges came our way. During this time, we learned how to move faster, respond to present events. So in the early days of COVID-19, the academies as a whole and NAM developed mechanisms that enabled timely and impactful action. We convened leaders, created a standing committee, conducted rapid expert consultations to provide guidance to US government and other stakeholders here and globally. We provided public information through webinars and outreach. These efforts address a wide range of issues, including vaccine development, access, data, disease surveillance and prevention, public health measures, and of course, the well-being of our clinicians. So with this approach, we also applied these approaches to other critical issues: women's health, firearm violence, health equity, and many, many more. But in addition, to increase our impact through action, domestically, globally, and across sectors, the new Academy have developed and adopted 3 core innovative models. First, Action Collaborative, which bring diverse stakeholders together to drive coordinated implementation. Second, Grand Challenges, bold global calls to spark innovation and cross-sector investment. And third, International Commissions, groups of high-level experts internationally that provide guidance on urgent global health issues. You know, when we first started this, there were doubts. I still remember so clearly, a most senior NRC exec told me bluntly, we advise, we don't implement. But the challenge we faced demanded a lot more. There had to be a way to galvanize collective action where stakeholders could lead the work and NAM would catalyze and support these important next steps. It was a shift in mindset, but because of you, it worked. I was able to listen to your ideas, and many of our significant achievements have emerged from these innovative approaches because you're willing to try something new altogether. The NAM provided structure and strategy, and our members drove collective change. You know, together, we've shown what's possible. We move beyond traditional models and work with diverse partners to share learning, align efforts, advance systems change. So allow me to take a moment to walk through each of our 3 innovative models with you, how they came to life, what they've achieved, and why they matter more than ever. First, Action Collaborators. You know, these were born from a very simple but powerful idea that meaningful progress in health medicine requires more than good ideas, but requires the right people working together over time with purpose. So collaborators are platforms that bring together stakeholders from across sectors, clinicians, researchers, policymakers, industry leaders, and patients and their advocates. We want to co-create solutions together, share knowledge, and drive real-world implementation. They're not just about generating consensus, they're about mobilizing action. And that's become one of our most effective tools for impact. For example, our Action Collaborative on clinician well-being and resilience. You know, it was inspired by Derek Kirsch and Tom Nasker, who came to me to say, this is a really important issue. I listened to them. They recognized the urgent need to address burnout and mental health among clinicians. And I think one of the most earliest and most powerful moments came when the publication of a tribute to Caitlin Elkins, a medical student who died by suicide. That piece opened critical dialogue at the NAM about breaking the culture of silence in medicine. Since then, we released a national action plan. We worked with Congress to establish a National Health Workforce Wellbeing Day, and launched a Changemaker campaign, now joined by over 480 organizations committed to restoring joy, purpose, and well-being in healthcare. So similarly, when deaths from opioid crisis escalated across the country, we immediately jumped to action, engaged with government partners, working with Scott Gottlieb at the FDA on prescription guidelines, with Brett Giroir at HHS to expand access to treatments like buprenorphine. And we pushed for more comprehensive science-driven response. This laid the foundation for our Action Collaborative on combating substance use and opioid crisis, a trusted forum for public and private sector leaders to come together to address this epidemic. The collaborative advanced best practices for pain management and harm reduction, and today its focus is expanded to include illicit drug use, polysubstance addiction, addressing social risk factors, and helping shape national policy and guidance in an evolving crisis. Inspired by this success, we turn to one of the greatest challenges of our time, climate change. And you know, I was a little slow, but at the urging of members like Charlie Halpern and others, we recognized how important this area is and brought health leaders into the climate conversation and make it a core NAM priority. So through our Climate Collaborative, we'll help reframe climate change as a health issue, not just an environmental issue. This collaborative brought together public-private sectors, care delivery, supply chain, academia, educators, policymakers, all to reduce the carbon footprint of the health sector, which in U.S. emits 8.5% of carbon of the total U.S. carbon, which is huge, and to create a more resilient health system. That shift is yielding real impact. In 2023, voluntary sustainable healthcare certification program for U.S. hospitals was initiated by the Joint Commission, led by John Perlins, who's here. Now, John credits his involvement with the NAM Collaborative as a direct impetus for this work. We appreciate it. And last year, NAM announced our initiative to accelerate climate health movement across the nation at the U.S. Climate Action Summit. You know, we're already drawn participation from 370 organizations, 50 health systems, and 625 hospitals. This is what it looks like when NAM steps into its full potential, leading where it matters, powered by the strength inside of our members. Collectively, these initiatives have broadened our role from providing advice to driving action, mobilizing the scientific healthcare, patient communities, and most importantly, improving people's lives. We've also innovated through the idea of a grand challenge or grand challenges. These initiatives are designed to inspire the nation and the world to coalesce around shared priorities and audacious goals for addressing big challenges and opportunities in science and medicine. We've used these platforms to set aspiration goals with an aim to inspire action at many different levels. We launched our first grand challenge. Actually, it was a year after I took over as president, on health longevity. We want to address one of the most urgent and universal health issues of our time, an aging population across the U.S. and much of the industrialized world, placing strains on an already overburdened health systems. By the way I got to this is I did a survey, asked all the members, what are the highest priority? This came up as number one, and health equity came up as number two. But of course, they're equal in importance. Jack Rowe, the late Tachi Yamada, and other leaders were instrumental in shaping the scope and vision of this initiative, helping us identify how to attract transformative idea and investment in this space. So as part of this initiative, we launched Healthy Longevity Global Competition, which you can see here, that spans over more than 50 countries and funds hundreds of innovators to help people think about how to live healthier. It's about health span over life course and more purposeful lives. Another component of Grand Challenge shown on the right hand of the slide is called the Roadmap for Health Longevity. It was led by Linda Fried and John Wong, and the roadmap's recommendations have been adopted by governments around the world to inform policy investment in global societies. Building on this success, we expanded our efforts in climate health and launched a grand challenge in climate health, which is chaired by Dr. Judy Roden. Launched in 2020, this global initiative aims to improve health and well-being by transforming the system that both contributing to and affected by climate change. You can see on this slide, we have 5 pillars: communities, communication, systems transformation, health sector resilience, and research reflecting the whole scale of the challenge and the urgency to act. Our work is making an impact. If you look at the roadmap and systems transformation in the middle, outlines high-impact strategy across different sectors: energy, food, transportation, and other critical systems, which with health at the center of all these sectors. This year, we issued a comprehensive research agenda that identifies priorities to accelerate transdisciplinary science and inform equitable adaptation strategies. And at the community level, we recognize that many marginalized communities are being affected. So we established this community network to affirm those affected are best positioned to lead solutions. Finally, to expand our global outreach and impact, we established a new mechanism called International Commissions, which are high-level, time-limited groups of international experts convened across science and policy and practice to address urgent issues at the intersection of health and society globally. Our first international commission showed how effective NAM can be globally in terms of crisis. In 2016, you heard from Jim Kim last night, as Ebola claimed more than 11,000 lives in West Africa, we convened a commission at the urging of Jim Kim and UN on a global health risk framework for the future. We have experts from 12 different countries participating, supported by NAM as a secretariat. The Commission report was among the first to frame pandemic preparedness as a security and economic priority that informed WHO reforms, laying the groundwork for stronger international collaboration. Building on this momentum, NAM and many of our members, including Chris Elias, I think he's here today, Jan-Nate Röttgen, Seth Berkley, Jeremy Farrar, and others were involved with a number of strategic international initiatives related to pandemic preparedness and global response to COVID-19. This included the founding of the Coalition for Epidemic Preparedness Innovation, CEPI, the Global Preparedness Monitoring Board, the 100 Days Mission, and the Access to COVID-19 Tools Accelerator. Similarly, in 2021, NAM served as secretariat for the G20 High-Level Independent Panel for financing the Global Commons for pandemic preparedness response. This landmark report led to creation of the Pandemic Fund, seated at the World Bank and WHO, and the Joint Finance and Health Task Force of the G20. And it's designed to mobilize resources and ensure accountability. Now that US funding for preparedness is being cut, and many countries are scaling back in their development assistance, the South Africa G20 presidency has reconvened the high-level G20 panel, which I now co-chair, but with NAM again serving as secretariat. We'll deliver these recommendations to G20 in South Africa later this year, looking at how to reshape financing for pandemic and strategies so that every country can strengthen its preparedness and ready for a surge if and when the next crisis hits. So this whole evolution, from making recommendations to catalyzing action, to me, is defining who we are. From the US to global stage, from academia to public-private partnership, the NAM has extended its mission to drive real-world impact. Well, actions have never been more critical. Here in the US, around the world, we've seen that we can no longer wait for someone else to act. In an era where almost everything is politicized, it's more important than ever that NAM remain independent, anchored in science, grounded in evidence, and committed to the public good. This year alone, you all know this, we've seen deep cuts to research funding, disbanding of government scientific advisory bodies, and the loss of career scientists from federal service. Access to public health data has been restricted, vaccine policy shifting just as preventable disease research, and Medicaid and other safety net programs face serious threats. And of course, we're still waiting to see when the current government shutdown will end. You know, our voices are more crucial than ever in this landscape. Early this year, more than 2,000 members of national academies signed an open letter supporting federal research funding. I'm very proud of them. Leaders like Steve Wolf, Vivian Ho, Paula Braverman, and others brought forward ideas that directly shape our engagement with the administration. I heard from a lot of you, so much distress. Are we doing enough at the NAM? So I convened an NAM kitchen cabinet to help steer our strategy for most urgent actions and the intersection of health, science, and policy. Because of you, the NAM and the academies are staying at the forefront of today's most pressing conversations in science, health, and medicine. This year, we've issued, certainly I've issued, and the Times with Marshall McNutt and the other president as well, Sujay Liu, on vaccine safety, effectiveness, measles resurgence, and need to protect integrity of federal data. With Ki Yamamoto, I co-chaired a paper on the central role of government-funded research, followed by a second paper with Sharita Golden and Clyde Yancey, calling for a national strategy on health disparities. And the third paper on Medicaid cuts and on health and workforce is forthcoming. You know, we also at the Academy fast-track some urgent work, from review of greenhouse gas science and public health to a landmark report on research regulation, showing that U.S. scientists are spending over 40% of their time on administrative tasks. This report proposed reforms to improve efficiency and productivity. And of course, yesterday, wow, what a great session. In a special session to share your concerns and recommended solutions, we heard clear calls for bold action, stronger coordination, deeper cross-sectoral collaboration to restore trust in science, not only in Washington, but beyond it, leaving our ivory tower to engage directly with communities and state and local leaders. You have also emphasized the importance of providing rapid, credible responses when needed and leveraging social media as a potential communication tool. Also, you suggested including applying NAM strategies and its strengths, if you will, using our established mechanism to convene, to publish, to conduct studies, and you suggested looking at long-term cost and impact of the current policies. These findings could inform a clear action forward, and I thank you for providing those thoughts. You also said we need to expand partnership, working with other organizations, private sector, regional groups, to speak with a collective voice and to develop actionable guidance for state and local leaders. And finally, we must address long-term challenges to rebuild whatever happens in this year or next few years, to address workforce development, and as Sam Silverstein reminded us, scientific secondary education to ensure that life science teachers are trained to connect science with health. And thank you, Sam, for making those suggestions. I believe this is what actions look like, and we're going to take it together. Now I want to recognize how the NAM staff has stepped up to meet the moment. Throughout my presidency, I'm deeply grateful to their insight, resilience, and creativity. At the NAM, we have more than 60 talented colleagues in finance, administration, fellowships, membership, and programs, bring integrity, professionalism, and purpose to everything they do. They're the backbone of this academy, keeping us strong, mission-driven, and grounded in its core values. From navigating challenges of COVID-19 to shaping our culture, advancing new initiatives, our staff have been central to help NAM adapt, evolve, and lead. So it is thanks to you, our members and staff, that I've been able to take on complex challenges, pursue bold ideas, and sustain momentum. I learned so much from each one of you along the way. You know, I've been thinking a lot about the future of the NAM and the people who shape it, our members, our staff. They aren't just part of a success story. They are the ones who carry it forward. With that in mind, I'd like to share a few lessons I learned during my time as president. Lessons I hope will continue to guide the Academy in years ahead. First, stay mission-driven, stay mission-focused. Second, now lead with communication. We heard from you loud and clear yesterday. Beyond just sharing data information, we have to foster two-way or multiple-way ways of dialogue, co-create solutions, and ensure our work reflects the priorities of the communities that we serve. Invest in people. Our future depends on empowering diverse leaders, staff members, and the next generation. Prioritize relationship. And finally, remember our North Star. Health is not a privilege, it's a right for everyone, everywhere. As I look ahead to 2026, I promise to be as focused in my remaining months as I was in my first. My priority is to ensure a smooth transition and to position NAM for continued success in decades to come by adhering to the following guiding lights. First, we'll continue to sustain strong programs, because that's really what allows us to make impact. Second, we need to work hard to ensure a stable foundation for NAM, despite the current financial impacts on the national academies and elsewhere. We are actively exploring new strategies for resilient and sustainable support to ensure NAM's ambition and its mission to continue without faltering. Third, help NAM remain responsive to the moment. We continue to find ways for NAM to adapt to current realities, weather ongoing challenges, and stay focused on solutions. That includes ensuring our staff to remain future-focused, proactive rather than reactive, support with stability and opportunity. They need to thrive. And finally, ensuring a seamless handoff. My goal is to fully support our next president so that she or he is well equipped with clarity and confidence and momentum to carry NAM forward. And of course, as I look to the future, I would like to remind you I have another 8 months of work to do. I'm not done yet. To borrow from Mark Twain, reports of my death are greatly exaggerated. So before I leave you, let me say what a profound privilege it has been to serve this remarkable community and to lead the NAM. You know, I've never imagined I'd be standing here today. When I came to this country as an 18-year-old student and immigrant, as a child, my family fled Communist China for Hong Kong. I saw first-hand effects of poverty, malnutrition, and poor health. Those early experiences inspired me to pursue medicine and to dedicate my life to making a difference. Leading the NAM has been the greatest honor of my professional life. I'm deeply grateful for your partnership, your trust, your unwavering commitment to our shared mission. Over the decades, we have faced unprecedented change and challenge. I could not be prouder of how NAM has risen to meet each moment. So as I enter this next 8 months, I will do so with confidence that NAM is resilient, ready, and prepared to meet whatever future brings. And I'll continue to serve as a lifelong member, a proud colleague, and a champion for values that unite us all. Thank you for a wonderful 12 years. It's meant the world to me. Thank you. Thank you. Okay, I'm going to take a picture. Don't sit down yet. Oh, she told me to take a selfie. Thank you. Thank you. Thank you. Okay, thank you so much. It means a lot to me.